the most important aspects to selling the Soniquence technology properly is knowing how to give a really good, thorough demonstration, and that's what I'm going to go over with you today. Most important, when you're setting up the Soniquence technology, you want to have it on the Sonic cart. The cart is a beautiful way to display the equipment, and it shows it as a full system. It also has this very nice handle for your hand pieces and your bipolar, and it also has a space below for your foot pedal. I do want to talk about the foot pedal for a moment. It has a yellow and blue pedal. The yellow activates the cut and blend settings. The blue activates the hemo and bipolar settings, and the bipolar turbo button is exclusive to the bipolar turbo settings. I'm going to put that on the floor. And while we're at the machine, let's talk about the settings. I generally like to put the cut and blend settings in the low 20s, and this dial allows you to toggle between cut and blend, and you can adjust the power accordingly for each one as you see fit. Similarly, down below, this select button toggles between hemo, bipolar, and bipolar turbo. I like to set the hemo button in the low 40s for hemo, and for bipolar and bipolar turbo, somewhere between 10 and 15, I have them set at 12. This is where your 3-button handpiece plugs in, right here. And here is where your bipolar cable and forcep plug in. And here is where your neutral plate plugs in. And I want to talk just a minute about this neutral plate. We have a nice, soft, comfortable neutral plate. And because we're using Soniqfrequency, this plate does not require direct skin contact. It can be outside the clothing or under the sterile drape of the patient. Today I'm going to slip this underneath the plastic bag, showing that it does not need direct skin contact. When demonstrating the Soniquence Soniqfrequency technology, the most important aspect is to have your client not confuse it with electrosurgery and electrocautery. Soniqfrequency produces much less thermal damage and therefore produces a much more improved and faster healing result. Okay? What I'm going to do is I'm going to activate the middle button, which is the blend setting. I'm going to come over here to this meat specimen. I do recommend red meat. And I'm going to make an incision through here. And then the most important thing for you to do when demonstrating this is to open this up and show your doctor how little thermal damage is produced. You don't get any of that blackened, charred, burned effect that you would get with traditional electrocautery. The the top button is the cut setting. This is 90% cut, 10% coagulation, and this gives you a nice clean cut with perfect edges for suturing and also for taking biopsies. I'm going to take this straight wire, fine wire out, and I'm going to grab one of these loop tips and insert that in. And I'm going to press this top button and show you what it would be like to take a biopsy. You just let this glide in and out of the tissue. That specimen can be sent right to pathology, and they will have no trouble reading it because you're using Soniqfrequency with the cut setting. The blend setting is the one that's used most often for removal of lesions or tissue that you're not sending for biopsy. You just let that glide in and out of the tissue. If you do feel any tissue drag or resistance, you can go to the machine and increase the power slightly. And then just let this glide through the tissue. As easy as that. There should be no resistance. Notice that the underlying tissue is not burned or charred. That will give you really good healing results and tissue reepithelialization. Now I'm going to switch back from the loop electrode to the fine wire. One of the things I want to show you is just to show the doctor that the active wire never gets hot. It is just a transmitter of Soniqfrequency. Is I'm going to activate this tip, and I'm going to go from the meat specimen, keeping it active, going directly to this plastic bag. You notice that it will not melt or burn the plastic bag, but it will cut the meat. The reason for that is the meat has water molecules, whereas the plastic bag does not. And right after I turn it off, I can touch it immediately, just to show again that the wire never does get hot. Okay? Now, for bleeding control, I'm going to put a ball electrode on here, and I'm going to activate the blue button, which activates hemostasis, and very lightly touch the bleeding area, and that'll control your light to moderate bleeders. If you have a heavier bleeder, you can do one of three things. You can either take a traditional metal forceps, touch the blue button and the ball electrode to the metal forceps, and that will send the sonic frequency down to the tips and coagulate your larger bleeders. Just to show that I'm holding a metal instrument in my bare hand, this shows how safe sonic frequency is. I could actually grab a piece of tissue, touch it up here, it'll bypass my fingers without a glove and go directly to what's called the pathway of least resistance. Much safer than traditional electrosurgery. The best way to control larger bleeders is to take our bipolar cable and bipolar forceps and activate. We have two bipolar settings. We have the traditional bipolar and the bipolar turbo. The traditional bipolar turbo, activated by this blue foot pedal, will give you pinpoint accurate bipolar coagulation in a dry or wet field. This is excellent for any type of coagulation of smaller bleeders, especially near critical anatomy, where you really want to control that energy. If, however, you're struggling with a larger bleeder, you can step on the bipolar turbo pedal and you'll see a significant difference in the amount of output power with the bipolar turbo setting. So that is the basic demonstration of the Soniquence sonic frequency technology. From that basic demonstration, you can then incorporate different attachments for dermatology, plastic surgery, ENT, ophthalmology, gynecology, oral surgery, or any other specialty that you happen to be demonstrating to.